is it a myth that pregnancy can cure bipolar disorder? I stopped taking my meds when I found out I was pregnant. I've been med-free for 2 years now. I know that no professionals will encourage me to stay off my meds, but is there an actual explanation or theory about this?
Yeah, thank you so much for the question. And first of all, I'm really glad to hear that that you've been well for a couple of years now. It's fantastic, and that stopping your medication, it went smoothly, and you didn't have any episodes in the postpartum. That's really great. And as you heard from Carrie, it's we know there are lots of examples of people who are able to do that. And in terms of the literature, I'm aware of some that have found some lower risk for an episode during pregnancy, but generally speaking, there's the higher chance to have episodes in the postpartum. And at the moment, unfortunately, we have no way of really predicting who's going to be the one that develops an episode in the postpartum. I think we can speculate in terms of, like, if the more of that support that you have, the lower the chance would be. And I think there's people who are at higher risk, especially if they're really isolated, and if there's also a lot of other societal pressures that they're facing that are unsupported with. But in terms of a cure, I would be very hesitant to use that term. And I think it would still be important to continue to just keep an eye out for any signs of any symptoms recurring. And just to be aware, and if you have a partner or families or friends that are also kind of keeping an eye out for that, that can help head anything off if it does start to kind of ramp up, then I think that's all you need to do, in a line with continuing all those self-care strategies. But yeah, no, I think there's a lot more research that needs to be done to understand the impact of hormones and changes around pregnancy, and how that impacts mental health.